Hi, my name is Jason DiLorenzo, and I'm the Executive Director for an organization called Doctors Without Quarters. We are a student loan advisory, and for the past several years, we've served as a resource for Utah Housestaff in understanding and navigating the complex and evolving student loan marketplace. The purpose of today's presentation, and what I'm going to share with you in the next few minutes, is to help you understand some of the recent updates in the student loan marketplace, both in the private and public sectors, to help you guys make better educated decisions about managing your student loans. Specifically, what I intend to cover in today's discussion are an overview of the debt and income environment for today's Housestaff. We're going to talk specifically about the value of income-driven loan repayment options during your training. And we're also going to cover an overview of the new revised pay-as-you-earn program. We'll also talk briefly about switching federal loan repayment programs, when and why that might be applicable to you. And we're also going to touch on the proposed public service loan forgiveness program changes and other legislative updates that you should be aware of. Finally, we'll delve briefly into considerations and best practices for loan refinancing. Doctors Without Quarters does also exist as a resource, and at the end of the discussion, you'll get our contact information should you have further questions. I certainly don't need to tell you as an audience that debt levels for doctors have increased dramatically over the course of the past couple of decades. What it's important to understand is that how much debt you have, coupled with how much money you are going to make when you're done with training and what sector you are going to work in, are all considerations that should inform your repayment strategy today. And this is a strategy that should likely be updated annually as you recertify your income for the income-driven loan repayment plans. I can assure you that as you are evolving as a professional, so is federal legislation, and it's important to stay abreast of changes to make certain that your strategy is always current. What I've highlighted on this slide are your available repayment options on federal student loans, listed from lowest cost down to highest cost. What I want to highlight in this menu of options are the repay program, revised pay-as-you-earn, and also the private refinancing marketplace, which is an opportunity for some Housestaff to reduce the interest rates on their federal student loans by refinancing those loans with a private lender. I do want to highlight to those of you that are in forbearance or deferment, it is my general belief that those programs now, while they allow you to pay zero on your loans, are the most costly student loan repayment programs for doctors in training, because they offer no loan forgiveness and no interest subsidies, and the payments in the income-driven plans can be affordable, modest, and position you for significant savings. Here I'm showing a summary of what a 4-year training should look like using the government's current, and you may be in this program already, the Pay-as-you-earn program. And here I'm showing a 4-year residency with a starting salary of $50,000 and $175,000 of student loan debt at roughly a 6.2% interest rate. Over the course of 4 years, the payments in the Pay-as-you-earn program start at zero in the intern year, and perhaps this is something that you were able to achieve, and then moving on up into the 3rd and 4th years of residency at close to $300 per month. In the Pay-as-you-earn program, this borrower is able to file their taxes married and separately, if they're married, to isolate their income for the purposes of keeping their student loan payments lower. The benefits in this case are certainly your interest payments that you're making over the course of 4 years, which amount to about $7,000. There is no capitalization of your interest that accrues while you're using this program, and you have the hardship that qualifies you for it. And if you had subsidized loans from either undergraduate or grad school, the government does continue to pay a modest amount of interest on those subsidized loans. And finally, the Pay-as-you-earn program is also public service loan forgiveness eligible in those years that you're also working full-time for a public service organization, i.e. your residency and fellowship, if applicable, at the University of Utah. In December of last year, the government introduced a new income-driven loan repayment plan called Revised Pay-As-You-Earn. And Revised Pay-As-You-Earn is available to anyone that has federal student loan debt, regardless of when you took out that debt. It works very much like Pay-As-You-Earn in that it requires 10% of your discretionary income. However, in Revised Pay-As-You-Earn, 50% of your accruing interest is not charged when your monthly payments don't cover your accruing interest. So let's take a look at how this looks in a simplified example of a borrower who has $200,000 of federal student loan debt with an average interest rate of 7%. Over the course of a year, that debt will accrue $14,000 of interest. If you're in Revised Pay-As-You-Earn and you're paying $250 a month based on your residency salary of around $50,000 a year, those monthly payments amount to $3,000 over the course of a year. If you have $14,000 of accruing interest, but you're paying $3,000 of it, essentially what you have is $11,000 of outstanding accrued interest in that year. Now, if the government is not charging 50% of this interest, then your savings is $5,500 in that year. That makes your effective interest rate on those 7% loans actually less than 4% during that year of training. This is a significant benefit that all residents and fellows need to understand. So if you're currently in training, you're probably wondering, can I switch from income-based repayment or pay-as-you-earn now into the Revised Pay-As-You-Earn program, and what are the benefits and drawbacks? Well, so the answer is definitely yes, you can switch into Revised Pay-As-You-Earn, and for a lot of you, you probably should. Your payments in Revised Pay-As-You-Earn also count towards the Public Service Loan Forgiveness Program. So if you've done 3 years in income-based repayment and you want to reduce your payment, get the interest benefit that Revised Pay-As-You-Earn offers, then you can move into that program and you'll still only need to do 7 years in a qualifying repayment plan before you can apply for Public Service Loan Forgiveness. A couple things to note here. When you do make the switch, you will be required to make a standard monthly payment on a 10-year term, which can be expensive for some doctors in training. You can also request a reduced payment forbearance for 1 month. This payment can be as low as $5, and then you can switch into Revised Pay-As-You-Earn. It's also always important to note that when you do change programs, previously accrued interest at that point will capitalize. However, there's a minimal impact there if you're pursuing public service loan forgiveness, but one that should be noted nonetheless. So some of you might be thinking at this point, $5,500 of interest savings every year I'm in training? What's the catch? Well, the fact is there is no catch with respect to Revised Pay-As-You-Earn. If you have a high level of student loan debt and a modest income, which most residents do, the interest benefit is very real and it's very substantial. There are a couple of situations or nuances to Revised Pay-As-You-Earn that I should mention. Revised Pay-As-You-Earn is going to require that you use your household income regardless of how you filed your taxes. So for those of you out there that are using IBR or Pay-As-You-Earn and filing your taxes separately to reduce the amount of income you show for the purposes of lower student loan payments and higher forgiveness, you're not going to be able to use that strategy in Revised Pay-As-You-Earn. Your household income will be used to dictate your payments. And so if you have a high household income, there's not going to be much, if any, of an interest benefit. It's also important to note, particularly as you finish training and your income goes up, hopefully substantially, that in Revised Pay-As-You-Earn, there is no cap to how much your payments can be monthly. In IBR and Pay-As-You-Earn, that cap is the 10-year standard amount monthly for your level of student loan debt. So as you transition to practice, it may make sense to transition from revised pay-as-you-earn to another qualified program if you're still pursuing public service loan forgiveness. So let's take a look at a brief case study here for a 2015 medical school graduate. In this case, she has $220,000 of federal student loan debt, and her specialty is OBGYN. She's not yet sure whether she's going to be pursuing a nonprofit or public service loan forgiveness qualified role, but she'd like to position to maximize those savings as best possible. Her expected future income is a salary of $250,000 per year, and maybe she doesn't know this yet, but she's getting married in 2019 to someone who earns $125,000 per year and has no federal student loan debt. What I'm showing here in this case is 10 years of student loan payments using an income-driven plan for the entire 10 years and pursuing public service loan forgiveness. In the 4 years of training before she got married, it made sense for her to use the revised pay-as-you-earn program as highlighted here. And then in year 5, when she transitioned to practice and got married, it made sense for her to file her taxes separately in this year and enter the pay-as-you-earn program and keep her payments low to maximize public service loan forgiveness. Some key numbers on this slide to review here would be the estimated out-of-pocket cost to pursue public service loan forgiveness over the entire 10 years using an income-driven repayment plan that sought to maximize savings and keep the payments as low as possible. In this case, her estimated out-of-pocket cost based on her salary was $120,000, in which case about $219,000 gets forgiven tax-free through the public service loan forgiveness program. The interest benefit in revised pay-as-you-earn resulted in an effective interest rate during training of a little over 3.25%. That's an important number to understand for yourself if you're looking at moving into the revised pay-as-you-earn program and you're comparing it to potentially refinancing your loans over to the private marketplace. But before we get into a discussion of the private refinancing marketplace, let's cover public service loan forgiveness briefly. As you probably know, the simple requirements for this program are you need to make the right kind of payment on the right kind of loan, and that's a federal direct loan and an income-based loan repayment plan like revised pay-as-you-earn, or the income-based repayment plan. You need to be making these payments while you're working full-time for a qualifying entity, and that's any federal, state, or local government or agency or any 501c3 nonprofit organization. This is where your residency and your fellowship at the University of Utah qualifies you. The best way to document your employment is through the employment certification form. If you're not familiar with this form, your GME office can make you aware of it and complete it on your behalf. What this says is that you were working for a qualifying entity for X number of dates, whatever you fill out on the form based on your previous employment there. This form isn't mandatory, but it is probably the best way, as it does get recorded by Fed Loans, who should be your loan servicer if you're pursuing public service loan forgiveness, as documentation in your pursuit of public service loan forgiveness. This is important should they make future changes to this program. So let's talk about some of these proposed changes. The three main sources of proposed changes to the public service loan forgiveness program and the income-driven plans that are available to you would be President Obama's fiscal budgets from the past 2 years, as well as the Financial Aid Simplification and Transparency Act, or called FAST Act, and the proposed reauthorization of the Higher Education Act. Some of the line items in these proposals would be to expand the pay-as-you-earn program to all borrowers. This was somewhat accomplished in the rollout of the revised pay-as-you-earn program. There was also a proposal to remove the payment cap on income-driven plans. This was done also through the revised pay-as-you-earn program. There was also a proposal, as you may have heard, to limit public service loan forgiveness to $57,500, or potentially limit income-driven repayment plan forgiveness based on your debt level or your degree type. What's actually happened over the past couple of years due to gridlock in Congress is nothing. There haven't been changes with respect to the budget. The Department of Education separately did, without action from Congress, introduce the revised pay-as-you-earn program, but no changes were made to the public service loan forgiveness program. It's hard for me to say with any level of certainty which way the needle's going with respect to proposed changes in public service loan forgiveness. I would expect that future changes will happen, and in fact, public service loan forgiveness at some point will be removed, capped, or otherwise altered. The big consideration for you all listening to this recording now is, would you be grandfathered in if they did make future changes? Most of the action I've heard in this regard is in your favor, that there is a historical precedent for grandfathering with programs like this. Suffice it to say, for most residents and fellows, because aggressive repayment isn't an option until you're a practicing physician, it normally makes sense to continue to pursue the income-driven plans, minimize the interest that's accruing, and position for loan forgiveness should it exist when you're done with training. Now let's take a turn here towards discussion of the private refinancing marketplace. As we see it, there's really a fork in the road in today's marketplace with respect to student loan repayment strategies for physicians who are transitioning to practice. If you continue to be positioned for loan forgiveness or need payment relief, then most likely the federal repayment options and public service loan forgiveness are the paths that you should pursue. However, if you are moving into a for-profit practice and you have the ability to pay down your debt aggressively, then it may make sense to refinance your federal student loans in the private marketplace to lower interest rates. So let's talk about when refinancing might be suitable. The opportunity for you all today is there's a marketplace that is very willing to refinance your federal student loans down to lower interest rates if your profile meets their needs and their underwriting appetite. This is a crowded marketplace with many players, and so you can use that to your advantage if, in fact, you've determined that refinancing is suitable. Rates can be extremely competitive. We see fixed rates as low as 3.5% for borrowers who have a 5 to 7 year time horizon to repay their debt. It is available while you're still in training. However, the best rates are not going to be available to those of you who continue to need payment relief during training. If you do have less than $100,000 or $75,000 of overall federal student loan debt, because public service loan forgiveness holds little value to you in that your payments required are still going to be over 10 years, probably in excess of $100,000 to $125,000, then it may make sense to look into the private refinancing marketplace to lower your interest rates even before you transition to practice. It is very important to understand the considerations and the risks of refinancing. First and foremost, you are giving up the federal benefits we've been discussing in this presentation, such as public service loan forgiveness, taxable loan forgiveness, the revised pay-as-you-earn interest not charged benefit. These don't exist with private lenders. You also want to make sure that there are no origination fees, as those can add cost, and you want to make sure there shouldn't be any prepayment penalties as well. You'll also likely be offered, if you apply, fixed rates versus variable rates, and you want to understand the risks of taking on a variable rate loan when historically rates are at near lows and will probably only rise from here. You'll also certainly want to take into consideration your time horizon for paying off your particular debt. The shorter your time horizon to pay down debt, the higher your payments will ultimately be. It's also important to understand, and you may not hear this from other sources, that you can refinance an already refinanced loan. If there are no origination fees and no prepayment penalties, and your underwriting profile or the marketplace gets better down the road, you can approach your lender or a different lender to get a better rate than even what you've gotten on the first time around that you refinanced. So, if you've determined that refinancing is suitable, only then should you approach the marketplace. And you should approach the marketplace, I often say, as an actor would in shooting a scene, in one take. That is, make sure that your underwriting profile It meets the right criteria to get the best offer the first time around. Some of these applications, and particularly if you're going to go to more than one lender to try to get the best rate available and leverage the markets against each other, you want to make sure that you're not getting declinations because you have a negative credit history when you could have added a cosigner, or that other underwriting considerations are positive so that you can get the best result. Once you've put together the best foot forward in terms of your application, then approach the marketplace. Our approach is typically to go to a competitive lender and review that quote. If it's at the low end of the range, potentially proceed with that quote, or you can use that quote as leverage to go to another lender in the marketplace. Then once you've got competitive quotes in hand, you'll want to choose a rate and a term and ultimately a payment that meet the context of your liquidity needs. So with that, I'll wrap things up. I thought it was important to share with you all the updates in the private refinancing marketplace to make sure that you understand that while these companies are actively approaching you to potentially refinance your loans to lower rates, it's only suitable in some cases and at certain times. And only when it's suitable should you proceed. I also believe that the revised pay-as-you-earn program is one that many of you should look into if you're currently doing income-based repayment or the pay-as-you-earn program. If you have any specific questions, or certainly if any of this information that I'm sharing with you now is somewhat new to you, it may make sense to wrap your arms more deeply around these programs and their benefit to you while you're in training. Thank you very much, and again, congratulations on starting your residency and training at the University of Utah, and I hope to talk with you soon.